Thank you, Honourable Speaker, for this opportunity to make a contribution to the motion before the House. And I must say at the outset that I fully support the motion, and I thank the Chairman and the Honourable members on both sides of the House that were part of this committee. And I stand as the Minister for Health today to say that we should support the Fiji Development Bank in its ennobling functions, ennobling in supporting the social determinants of health. On Monday, we had the two new colleagues to this Honourable House. Honourable Ratu Chonesenloli talked about how his interest is in the rural dwellers. We want the rural dwellers to be strong financially. And this is an institution that will support them. By ennobling them, by ensuring, by us guaranteeing, by the state, by this Parliament agreeing to it, and the government agreeing to guarantee, spreads the risks and allows the small shareholders, the farmers, to be able to upgrade themselves. And I know that many of us here will know of stories where FDB has been a financier in their development. I know for sure that at some stage in our growth as a family, my parents, they used the Fiji Development Bank. And I'm probably here because of that support through the Fiji Development Bank. The Fiji Development Bank has allowed many young people to become doctors and nurses. Many people have come from rural areas and become engineers and lawyers. And many of us sitting inside this August House, on both sides, have actually achieved what we've achieved through the support of the Fiji Development Bank. And that's the first and primary reason why I support it. Because it has ennobled many, many people. And there are many, and again, for my province in Lau, many have come into Viti Lewu. You go up to Waimbau, Lomaibuna, where they've been farming. Honourable Chale, Honourable Chale knows specifically this issue. That FDB is an ennobling institution for many migrant communities into Viti Lewu and Wulolewu. And why should we not support it now? Why should we not support it now? Why should we not support it now? It has allowed us to be here today. It has allowed many to be able to go to the university. It is a means by which we can improve the social determinants of health, both in the rural areas and in the peri-urban areas. In 1st July 1967, when FDB was established, the board of directors then, and I believe that most of them will not be here today, are not here today, the board of directors then made strategic decisions based on the ambitions of the FDB then. The board of directors now and the CEO will make their decisions based on what the pertaining environment is. And the ambition remains the same, to support the development of the nation. We want the rural dwellers to have cars. We want the rural dwellers to be able to take their children to better schools. We want the rural dwellers to be able to send their children overseas. And this is an institution that can support them. And why are we not supporting it now? That's my question. And I think it's very hypocritical of all of us in this August House that have benefited in some way from the Fiji Development Bank to now turn our back on this development bank. It's very hypocritical. Why? Because elections are around the corner? Why? Because it sounds good to our voters? We shouldn't. And as I've said before, as the Minister for Health, I want to see mechanisms by which the social determinants of health are improved. And this is an ennobling institution to support the social determinants of health. And that is why I fully support the Fiji Development Bank and the motion before the House. Thank you, sir.
I thank the